Hello guys, once again Ijaz Hidayat is with you with the new talk and with new question. Today I have one question from one of my follower on my YouTube channel's name. The channel's name is Scene Brito 2886. The question actually he in a question there is so many questions. In a one question there is so many questions, so I divided all the questions in different parts. So his first point was how to explain the termination of CPB. Number two, the checklist before weaning of bypass. So we have to discuss about the checklist before coming off from the bypass. Number three, to give a tips how to maintain pressure and flow during coming off from the bypass. Last but not least, how to come off flow with the proper positioning of clamping or occluding the venous line. So scene Brito 2886, I'll try to answer you. And thank you so much for liking me, as you mentioned in the beginning that you like my content and you like my way how to explain. Thank you so much, bundle of thanks for your liking. So let's start to explain your questions. So I divided your questions in four parts. The first part is how to termination of the bypass. So once you initiate the bypass, there is two phases. One was initiating and the other was the weaning off. Similar like when you travel through the craft by the aeroplane, so you will find two phases. First phase is like a takeoff and the other phase is the landing. So here similarly, now you're the pilot of the perfusion heart-lung machines and now your phase is how to come off from the bypass. So before termination of the bypass, and your second question automatically going to link with your first question actually, the checklist before weaning of the bypass. So of course we have to do the checklist before coming of the bypass. Similarly, when we start the checklist to initiating the bypass, is the similarly we have to make some checklist to come out from the bypass. So there is a word called the LAMP protocols. So LAMP protocols, always if you follow the LAMP protocols, it will going to help you to come up from the bypass. And actually this is the checklist of your wean offering from the bypass. So L mean lab. So first of all you have to see the all lab reports of the patients before coming off from the bypass. So what are the lab reports you need to check? You have to see your acid base of the patient, pH level of the patient, PCO2 and PO2 of the patient, hemoglobin, hematocrit of the patient, lactate, and sodium, potassium, electrolytes is very important. So you have to maintain the electrolytes before coming off the bypass. And then temperature is another part of the checklist. So once your lab reports are fine, like your pH level is maintained, your PCO2 is normal, your PO2 is normal, your electrolytes is normal, your hemoglobin on an adequate level, there is no acidosis, so your blood gases seems which is ready to come out from the bypass. Number two is your A is the aim to come out from the bypass. So what are your aim to come out from the bypass? Your aim is to come out bypass to you have to start the ventilation from the anesthesia side. So your aim is to come off from the bypass. Similarly, you come to take off the bypass, similar to come off from the bypass. So how will you going to come? Your aim is to communicate between surgeon, anesthetist and yourself. So there's just three teams which is actively participating. One is surgeon, number two is anesthetist, and number three is the perfusionist. So you have to coordinate before coming off the bypass with the surgeon and anesthetist. M is the monitoring. So what are the things you have to monitoring? So monitoring, you have to see your mean arterial pressures. Your mean arterial pressure should be above than 50 millimeter per mercury and within range of 50 to 80 millimeter mercury. Okay. You have to monitor, you have to see the BIS if you are using the bus. Your cerebral sides should be above than the 50. And then you have to monitor the temperature of the patient. So temperature should be Above, your rectal temperature should be above than 35.5 degrees Celsius, and your nasopharyngeal temperature should be around like a 36.5 and above, like in 37 degrees Celsius. And then you have to be smart by monitoring your CVP and your as you know, you're on a pump, there will be no CVP. Once you started, then you have to, by following, you have to maintain your vein of your patient from the bypass by monitoring your CVP level. M, and then this is the P. P is actually the parameters, pressures, pump. So your pump flow, your parameters you already monitored, and your the pump flow should be like in the beginning, your the way you come off, initiate the bypass. Similarly, so now flow will going to be come out from the bypass. So your pump flow is a full flow. So how you will come out from the full flow to the with the low flow? Full flow, 3/4 flow, half flow, quarter flow, and off. So we're going to discuss later on all detail how to come off from the positioning when the time of we're just going to discuss about the positioning of the clamps. So what are the tips to maintain the pressure and flow time of CPB off? So the tip is, the first of all, make sure that your patient is properly ready to come off. Secondly, you got to coordinate with the anesthetic. The tip and to maintaining pressure is if your patients required some vasopressors, so you initially during the bypass you will get information all this tip. So to communicate with your anesthetist and start some small kick off like inotropes or like NORADs or vasopressors if needed. And target is to maintain the mean pressures, and once you are ready to coming from the vein off, coming up from the bypass, then from continuous flow you have to go to the pulsatile flow. So then you automatically get the systolic and diastolic and mean pressure. So how to come up from the flow and the proper positioning of the clamp. So you have 1/2 inch tube. So as we start the bypass, I recommend personally to my followers and my students and my lovers that what I learn I want to deliver to you, that if you are the new perfusionist, so always use the 4 clamps. The first clamp will be fully clamped to the tube, then make 1/4, so 3/4 of clamping of the tube, then make half clamp to the tube, and the last you should be in a quarter clamp occlude your flow the tube. So similarly, for example, if I will take a piece of tube and just wait, I'll bring the piece of tube, then I will going to explain you how to clamp the parts. Find this half tube, and my recommendation is when you are initially new person, so you first clamp completely, okay, then make it 3/4, and then make it to half, and then make it to quarter. So this is the tubes initially when you are the new perfusionist, and when you get a message by the surgeon to initiate bypass, so you remove this one and on bypass. So now you make your pump flow like a 1 liter. Example, you have full flow is 4 liter. Now you are getting 1 liter through this tube and 1 liter from the pump side, and then you can remove this line and you increase flow to 2 liter, and your drainage from through this will be get a 2 liter. And then third, remove this one and you increase from the pump side of 3 liter flow, and now you are occluded only 1/4 inches. And then the last, make your flow 4 liter and you are on a full flow pump. Now similarly, from termination of the bypass, you have to decrease 1 liter by occluding 1/4. You can decrease from 4 liter to 3 liter. Once you will find small ejections, increase your tube to half and decrease your pump flow to 2 liter, and then similarly go to 3/4 and decrease your flow to 1 liter. And once your ejection is okay, CPB is fine, pressure is maintaining, you come off from the bypass. Okay, so guys, the method initially I never open my clamp. Like when you go on bypass and suddenly you release the clamp and it's non bypass, it will you will face a trouble sometime. Like you will give the suddenly you will get a, once you drain completely from the heart, there is a chance of hypotension. So don't insult the heart. So go in a smooth way on a pump and come off smooth way from the bypass. Also wean off smoothly. Don't use a single clamp and come off from the bypass with single clamp and managing. So best is to use, if you're the new perfusionist, use your 4 clamp and go according to the like a 1/4, half, 3/8, 1/4. So similarly, when you are initiating bypass, go first 1 liter flow, then 2 liter flow, then 4 liter, 3 liter, and finally 4 liter flow. So you can manage pressure, you can manage flow, and you can maintain the mean pressures and what the effective communication. So in all these scenarios, the most important is your communication. Your communication should be clear and very you communicate with your surgeon when anesthetist one, and your target will be your CVP, and you just coordinate with the anesthetist how much CVP he needed. And once you come out from the bypass, you inform your anesthetist and the surgeon that I have this much remaining in my reservoir. So in case you have a huge amount, like more than 600 or 500 volume in the reservoir, so the anesthetist will going to dilate the patient, and he can accommodate all the volume which is present in the reservoirs. And once they started the protamine, please keep note the time of the protamine, and take the venous line. Once the surgeon will remove the venous line from the right atrial, so you can drain that volume into the your reservoir. And before finishing the 30% dose of the protamine, try to give your volume to the patient, and if your volume is still in the reservoir, you can make in a bag and hand it over to anesthesia that they can transfer from the head side, or either you can take all the circuit which is the volume which is present in your circuit, you can take all that volume in the cell saver, and you process and washed and get the washed back cell, and auto transfusion to the patient bag by anesthesia side. So the guys, I'll try my best to explain the methods of termination of the bypass. So always remember the lamp protocols. Check your labs, check your pressures, check your pump flow, check your monitor. Before coming off and before going on a bypass, even there is a checklist as we already discussed. So if you want, I can discuss the checklist. Prior to one pump, you have the checklist we already discussed in my previous videos. You can follow that videos and you will get the pre-pump checklist there. And you can use the coming off a checklist also, that you have to see your lab reports, you have to see the pump flow, you have to see the lab reports, and then of course communication between your surgeon and anesthetist is very, very important. And your what I want to deliver to you, keep it in your mind. Pre-checklist and come off checklist is very, very important for the perfusionist. The things which is need to be come off from the bypass, don't try to leave the operating room. Usually what we are practicing, once the canal is out, we left. Guys, try to be in a room, in operating room, at least after the completion of the protamine and decannulation from the patient side. Stay at least 5 minutes more to stabilize the patient, and then you can move and enter the data of the patient and enter your detail in your Cerner or whatever according to your protocol, hospital protocol. So guys, if you like this video, share among the perfusion community. I need your comments, so your comment is very valuable for us. Your feedback is very valuable for us so we can upgrade ourselves and we can share the knowledge which you needed. Have a nice and good day. Office.